A new study suggests a relationship between autism in boys and their mother's use of diet soda and other similar consumption of aspartame during pregnancy as well as for breastfeeding. Let's talk about it. Hey everybody, it's Dr. David. Hope you're having a good day. As many of you know, I am a pediatrician here in Tampa, Florida, and a very large focus of my work as a holistic and functional medicine doctor is preventing health and getting to the root cause of problems. And one of my main focuses for many years has been on preconception to infancy health and trying to optimize the health of mommies as well as their offspring. Okay, now very early on, as I know I've discussed before, I recognized that there was a big issue in terms of what moms were putting into the body or maybe missing from their body and how that could impact their child's development going forward, and not just developmentally in terms of their behaviors or their physical skills, but also development of things like inflammation, how their immune system is developing, etc. And of course, one of the big things that I'm a very big advocate of is breastfeeding. And so, therefore, not just what is being consumed by the mother during pregnancy, but as well as when lactating, will have an impact on the nutrition as well as potentially other toxic exposure that the baby is getting, especially during that very formative time of brain and immune system development, which is really our immune systems, our brain development happens the most during the first few months of our lives. Then there is more fine tuning that happens after that, but really, really critical once we're exposed to the outside world in terms of potential germs, how our immune systems react to it, how our nutrition is doing. That's why we recommend all babies be getting vitamin D really from the first week of life. And that's a pretty standard recommendation now amongst pediatricians, but I find they typically need a little bit more. But of course, also what's going into their bodies and how is their body handling it, for instance, if they are being exposed to toxins. But of course, coming back, I know I've talked so much about vitamin D and zinc and iron, but these are things that I am checking on lactating and pregnant women to make sure that all of that is good, because they are what, their babies are what their mothers eat or consume. Okay. So now, thankfully, there is much more discussion about all of this than there was when I started thinking about this about 20 years ago. And, certainly, unlike other things that I've talked about, nobody has ever really said, oh, David, that's not a mainstream concept, or that's something that's out there. The nutrition of, even when it wasn't being talked about, the nutrition and the health of the mother is always going to be understood to be an important thing for the baby. Okay. So now, in terms of artificial sweeteners as a whole, more and more information research is coming out in terms of negative effects. Okay. We know that there could be bowel issues. Okay. Sometimes there could be the microbiome itself could be disturbed. One can get loose stools, especially from the sugar alcohols coming through. That can affect absorption, etc. Obviously, very loose stools loses more fluid, potential for dehydration. But there has also been research that shows that artificial sweeteners have been associated with things like cardiovascular health, heart attacks, strokes. Okay. And it's also been associated, and again, more in this world here, with premature babies being born. Okay, so that is some pretty significant stuff. Okay, now the title of the research that I'm about to talk more about is one of the more self-explanatory titles that I've ever reported on. But let me get it right. Daily early life exposures to diet soda and aspartame are associated with autism in males, a case control study. So I guess I can stop this video right now, because that's about as clear as you'll ever get. So many times when I'll see a research study, and when I get to the conclusions and I dig deep, it's kind of obvious what something is. But often they kind of couch it or make it a little bit more uncertain of what are the effects of aspartame on autism. But no, they're saying it right here in the title, which of course is a wonderful attention grabber, as this should be. Okay. Now, this is particular research that was done at the University of Texas Health Sciences in San Antonio, Texas. Okay. And they did show that there could be this link between autism, between aspartame. The commercial name was was NutraSweet when we first started doing this. I think it's kind of interesting. I don't know if it's because it's become a generic, but you'll rarely will ever see NutraSweet on packages. Now it just says aspartame. And I also wondered, because NutraSweet was getting a bad rap, if the manufacturer, these food manufacturers, decided, well, let's just call it aspartame, and then people won't see that there's NutraSweet on the label, and maybe they'll buy our products. I don't know if that's true, but gosh, it seems kind of interesting that they dropped the word that a lot of people were having concerns about, but yet they didn't drop the ingredient. Okay. And what they were showing to women, so this is what's called a retrospective study. Okay. So it's not like they were giving X number of people all this diet soda and this number's not, and see what happens. The retrospective means that they look to see first, they would separate the children into two groups: kids with a diagnosis of autism, and then kids who were considered neurotypical. Okay. And for that, there was actually 235 subjects, families with a child with autism, and 121 who were neurotypical. So not huge numbers, but certainly some pretty, not one or two subjects either here. Okay. And what the women would do is they were asked to recall how much diet soda or other NutraSweet / aspartame products were being consumed during pregnancy, during lactation. Now, of course, there is a flaw when it comes to retrospective studies, especially if it's a few years out from when it was, and maybe they don't recall. Most women, though, that I do work with, if there's anything that they remember most, they remember their pregnancies, they remember childbirth itself, and etc., because it's such an important time in their lives. Because once you're growing, you're eating for two, you're growing another body inside your body, you're going to pay attention to those things. So of course there is always the potential for error, but that's true on both sides too. That's why you want to get big enough sample size to try to cover for that, because they ask both the neurotypical families and the children with autism families, what did you consume? Okay. Now, what did they find? Okay. So what they found is that boys who had a diagnosis of autism spectrum disorder were 3 times more likely to have their mothers consuming NutraSweet than neurotypical, when they were doing these reporting. And what the definition was, the consumption of at least 1 or more servings per day of diet soda. Now, the amount of aspartame, they would also figure out, like, if it was in some other food, candies or whatever, that they would have what's called an equivalent amount of the aspartame. Okay. And so what they interestingly found, though, despite that there was the 3-fold increase in autism in the consumers, that was only in boys. When they looked at girls, there was no difference. Now, we do know that overall, that autism is more commonly happening in boys than girls. But here in this case, even when all things being equal, they saw with the girls, it didn't make a difference. And the interesting thing is that where they saw the biggest increase is in kids who had non-regressive autism. And let me explain what that is, because most commonly, when I see a child with autism, kids with autism, there is very often a period of normal development followed by a stopping of development or a regression. So that's regressive autism, or at least a plateauing where there's not the continued developmental slope that you'd expect to see. So the kids who did not have the regressive autism, those who were showing symptoms early and who didn't regress, those are the ones who had the biggest issue. And that kind of makes sense because, again, if the exposure was happening in utero and during lactation, then it would make sense that there may not be regression in those, because the exposure had happened already. Maybe in those who have regressive autism, there could be a virus or a medicine or something else given to the child that could have been the trigger that made the regression happen. So that is kind of an interesting thing. Okay, now what's my take on all of this? First of all, water is best. Water is best. Water is best. We know that for everybody. That is certainly true for pregnant women as well. Okay. If you have some sweet tooth needs, use whole fruits. Smoothies are good as well. More so than juices, because it doesn't have the fiber, in the pulp, etc. So there's much more of a sugar load that hits the body quickly, shooting up the insulin when it comes to either sugary sodas or juices, but it happens much less in whole fruits and in smoothies. Okay. Also, if you're doing a smoothie, You can also throw some protein powder in there too, and there's lots of different ones depending on what, obviously they have vegan forms for people who have that, who are needing something plant based. But of course, there's egg protein based. There's milk based proteins. There's lots of different options that are out there. But one of the things that protein does when it's being consumed with sugar is that it slows the spike of the sugar in the bloodstream, and therefore the insulin spikes that can happen. So it's more of a smoother rounding of that blood sugar going up, and that is definitely more beneficial than a quick spike. Okay, but if you need to have something to sweeten a coffee or whatever, in moderation, I would choose cane sugar. I would be using, I would be considering, but other things, honey could be used. Okay, maple syrup could be used. Obviously, there's organic versions of those as well, and they are sugar. They still are considered added sugars, but there are natural versions. But in all honesty, if there was a choice of that or doing NutraSweet, that's what I would do. Okay, and then my last take on all of this is realistically avoid artificial anything. Okay, if there's a very chemical looking name on the package label, if there's a word you can't pronounce, it's probably synthetic. A whole diet, whole foods, whether it's in animal products, fruits, vegetables, legumes, whole grains, that's the way we all should be doing it. And that's especially important during pregnancy and lactation. There you go. Hope you have a nice day.